Hello, hello, hello. Happy Tuesday and happy March 2022. Sorry, I'm a little out of breath. I was running up the stairs. Anyways, happy Tuesday, happy March. I didn't give any notice I was coming on tonight. I'm usually on Tuesdays, and most people know that I'm on Tuesday. So some people are calling me saying, "Are you on or not?" But I'm here. I got everything. I was gonna read off my phone, and then I'm nearsighted. That was not gonna work, so I had to print it out. But anyways, happy Tuesday. Let me first start off by saying happy Tuesday, happy March, happy birthday to everybody celebrating their birthday in the month of March. Um, I was told the last time that I sang happy birthday to the other people in February, so I better sing it to the people in March. So, anyways, our happy birthday to you, happy birthday to you, happy birthday, happy birthday to you. Remix, happy birthday to ya. Okay, so, but anyways, and I work today, so I'm a little tired. But anyways, happy March. I'm happy to be here. I hope you guys are all well out there in cyberspace. I know there's so much going on in the world right now, but we just have to, just make do the best way we can. Take it slow, release the stress as much as possible because there's certain things out of our hands that we can change there. I'm just looking on the screen here for a second. Sorry. So we can change and we have no control over. So if you can pray, pray. If you believe in a higher power, meditation, whatever it is, just try to do your best because there's not much we can do about that. So I'm just gonna click over here for a second. But anyways, so as the topic shows that what is dialysis? Some people have been asking me about the dialysis and all that. Of course, they're asking other people who are in healthcare. I'm not the only person about dialysis, and also the dialysis center that had just opened up back home. So some people are concerned about that. They want to know what it is, and not everybody, even people in America and all that, don't know what dialysis is. And if you're not something that concerns you, you may not be too well versed about it. So and when it comes to kidney disease, it's very complex. So I was trying my best to try to make this to where I could, because I'm speaking across like a broad spectrum of listeners, those who are highly educated, but you can be highly educated in one part and not educated in another part, and just for the broad listeners back home and overseas and everywhere. So I tried to make this as less complex as possible. Okay, so as always, my disclaimer, whatever I say here, right now is from the Kidney Foundation, nephrology group, and all that family practice guidelines. So whatever I say here, you want to make sure that you speak to your provider first before making any changes to your regimen. Okay. Formally, my name is Abby Tyler. I am a family nurse practitioner. I also come with 22 years of RN experience. And when I was in the hospital, I did a lot of dialysis, prepare my patients for dialysis and all that. So now that I'm working in a private setting, I work in private practice in Philadelphia. So I'm seeing it from the primary care point of view. Okay, so let's just get into this right away. Okay, so what is dialysis? Sorry, I have my little cheat sheet over here. Like I said, to present it to a wider audience, you have to get your stuff together. So, what is dialysis? So, the kidneys perform an important task of cleaning the blood and the toxins out of your body. That's something you don't even have to think about. You get up, you go to the bathroom, you have to pee, you go here. Sometimes I'm gonna go back and forth with using slang and proper terminology. Urinate, pee. You do that and nothing happens. You have no back pain, you have nothing, it just comes out automatically. There's nothing you have to do about it. But then there comes a time where you start noticing that that may not be happening, or maybe other reasons that is discovered later. So by your primary care physician, or maybe you went to the hospital for a reason and they find out that your kidney is not good. So dialysis is a treatment that uses a machine to mimic the kidney's job of purifying the blood and keeping the body's electrolytes in balance. The electrolytes. It's the electrical chemical in your body, your sodium, your potassium, chloride, magnesium, all those other things that keep your body moving. That's supposed to work within range. And that's like one level is supposed to be, they're supposed to stay in range to keep the body homeostasis. So all of that work together along with the heart and the liver and all. But most of the food that we eat or like medications or other things also filter out through the kidneys. So when your kidneys don't no longer work, that's when you need dialysis. And it's a huge big, I'm sure most of you have seen the machines today or the 10,000 pictures that we've seen on TV, that we've seen on social media. So you go there, it's like a 3 to 4 hour treatment. It's 3 times a week. So that's what dialysis is. It cleanses everything in your body, the toxins out of your body, because if it stays there and your body cannot put it out and there's no other way of doing so, you start going into heart failure, you start having a heart attack or anything, because the body needs to take out the toxins that don't need to be in the body. Okay. So it's like let's say you put a lot of stuff together and you're cleaning, let's say you're cleaning grains or whatever, and all the dirt that comes from the grain, that cannot be within the food. Okay. Because if it goes in the food, you're going to get toxic and you could have a problem with that. So we'll go to that. So the causes of chronic kidney disease is, I'll go into that. Chronic kidney disease and kidney failure. The chronic kidney disease is 5 stages of chronic kidney disease or slash failure. When you get to stage 5, it's when we start worrying about, that's when you have to have dialysis. Okay, so some of the causes of chronic kidney disease, non-steroidal inflammatory drugs, like they tell you ibuprofen, naproxen, all those things. People take them for like arthritis. They take it for headaches. They take it for menstrual cramp. They take it for so many reasons, pain, whatever. And the more you take of that, the more you, especially for people who need it very often, the more you take it over a period of time, that breaks down. It's very toxic to the kidneys. And then the kidneys you start having issues with your kidneys. Again, you won't know that. And most times stages like 1 and 2, you don't have any symptoms or nothing like that, unless if they tell you that this is what's going on. So that can also cause that. But most people need that, because if you have arthritis and things like that, those are the first line of drugs that we use to help you before we start moving to stronger things like steroids and all. So steroids can also have that. Some diabetic drugs, can also cause that, but uncontrolled diabetes can cause that. Some hypertensive drug, because it takes the fluid out of your body. So over a period of time, that can also cause you to have some dehydration. But of course, your doctors will be monitoring that. Okay, some autoimmune diseases too, like lupus, that can also affect the kidneys over a period of time. And sometimes it happens like very early, especially when you get diagnosed with lupus very early. Usually kidney failure is one of the main complications of that. Persistent and untreated UTI, urinary tract infection. If you have urinary tract infection over a period of time, that's when you're burning, when you try to urinate, difficulty urinating. You notice also sometimes people have issues with when they're having sexual um, relations, because of course, like I said, with women, you have it there and everything is so close to the vagina. So when you're doing that, you can have problems, burning, discharge and all. So if you don't go to your doctor and you don't get that treated over a period of time, it may heal on its own, but over a period of time, when that because of urinary tract infection, your kidneys and everything, your ureters are like closer down to your pelvic area. So excuse me. So if that remains untreated over a period of time, that also moves up to the kidneys, and that could cause a problem. Your kidneys are in your back, by the way. I'm turning around like you can see my back. They're in your back. So when you look at the picture, you can see the picture when you see the diagram, but it's mostly in your back. That's when it acts if you have like back pain and things like that. Okay, certain acute and chronic diseases, like I said, sometimes uncontrolled diabetes, untreated diabetes, severe hypertension, and hypertension is high blood pressure over a period of time. If your blood pressure is not maintained, all that pressure and all that resistance also can also kill the kidneys too. Certain medications, severe dehydration, if you're not drinking enough over a period of time, especially if you live in places where like water supply is not readily available, or if you're sick and you don't feel like drinking, that's what we tell our patients. Even if you can't eat, try to drink and just keep drinking. You keep sipping here, in order, because you don't want to get dehydrated. Insufficient blood flow to the kidneys. You may have an injury that causes your blood flow to your kidneys that can cause that. And when there's no blood supply going to the kidneys have to function with the blood and nutrients and everything. And if that happens, you can also have problems with your kidneys. kidney trauma, again, injury. Like, if let's say if you had like a back issue, back injury, somebody you got hurt there, you fell, landed on your back to where like the swelling and all of that. If you had any kind of paralysis and stuff like that, that also decreases the blood flow to the kidneys, and also, and because you have no feeling below your waist if you're paraplegic, and quadriplegic is from the neck area. So anything that causes any kind of harm to kidneys, that can also start you in the process of a chronic kidney failure. I'm not, there's like a whole lot, so I'm not going to go through everything. I already told you that insufficient blood flow to the kidneys, if you have a blood clot around your kidneys, infection, I already said that, heavy metal poisoning, sometimes the environment, drugs and alcohol. I'm just going to go over the main ones and all that too. So those are some of the causes. This whole list is not comprehensive, by the way. That's why I always tell you to check with your family provider. Okay, and I told you the autoimmune diseases and loss. Okay, so prior to kidneys, this is where it's really important to have all those people in your environment, in your nation, in your city, working along with you. Because prior to you needing dialysis, most times you wouldn't know. So it's important that you go to your family doctor every time, every year, have your annual visits, and also periodically based on what pre-existing diseases that you have. So it's important that you go when you go to the blood when you go to your doctor's office. Like if you came to see me and you were a new patient, I'm going to do all your basic labs. I'll do your CBC, your blood count. We checking for anemia. We checking for an infection where somewhere in your body. We'll be checking your liver function, your kidney function, your electrolytes. We're gonna need a urine sample, so we make sure we see all that. So all those things, as we start doing that, and we're looking at the other diseases that you have, like your high blood pressure, your diabetes, all those things can also lead to chronic kidney disease, like I said before. So we're going to be monitoring the kind of medication that you're on. We have to make sure. That's why I said when you go see the doctor, you have to tell them all the other doctors that you're going to go see, that you see, because sometimes the primary care doctors don't always get all that information. And even when we send you to another doctor, they won't get all that information. So we'll tell you, and sometimes we don't know what other medications you're taking, and you may not know. And if we check it up in the computer system and in the pharmacy system, it may not be there up. It may not be up to date when you come to see us. So it's important that you go there. We're going to be checking, like I said, your blood work. We're going to be looking at your medications, anything in nephrotoxic, meaning anything that's going to be dangerous to the kidneys. Okay, your symptoms when you're telling us, I'm not urinating as much as I used to. Now, there may be other reasons why you're not urinating the way you're used to. Okay, especially for men, that could also be because you have like an enlarged prostate. So that could be the reason why you're not urinating as much. So it has nothing to do with kidney disease, but also when you're not urinating as much, all that urine stored in your body, it stays and it builds up into your kidneys there. That could also lead to that. Okay, if you may have other issues that you were born with, kidney disease, congenital kidney disease, other things that could cause early kidney. That's why you see like younger kids need kidney transplant very early. So there's so many reasons why. That's why also for younger people, please make sure you're taking your children to the pediatrician every year and as regularly as you're supposed to be. So so there are five stages of kidney diseases. All right. Chronic kidney failure, kidney disease. All right. It's chronic because then over time there's other reasons like renal, post renal, things like that. I'm not. It's like I said, it gets a little bit too complex, so I'm not going to go too much into that. Stage one. Remember last time when I spoke, I said know your numbers when it came to heart disease. And I also told you to know what your GFR is, your glomerular filtration rate. That's what we look at when we start looking at your kidney disease. So anything, if you go to your doctor and your doctor, you say, well, doc, what's my GFR? Or your provider, because provider could be your NP or your PA. Okay, so anything greater than 90, they'd be like, you're good. Depending on if that's the only thing that we're looking at now, because as doctors, we don't ever and providers, we don't ever just look at one thing. We look at a whole picture. But if that's what you want to know, we will tell you and talk to you about it. So your GFR, if it's over 90, you'd be like, you're good, I'm fine. Also your BUN, the blood urea nitrogen, also your creatinine. That's also another one that also we look at to see if you're dehydrated too. And if that kind of concerning, then we also look at both pictures and then again look at your symptoms. So if you're over 90, you're good. Stage two, that's mild. So 60 to 89. These numbers vary a little bit depending on, it different in other countries, but they're pretty much around the same range. So stage two, this mild. So we'll say, chronic kidney disease stage 2. So usually by then we're not really worried, but we'll also be looking at your medications and looking at medications again that are nephrotoxic, and again looking at your other pre-existing conditions and kind of saying, okay, let's just keep an eye on that, because we don't want to go any more than that. If it starts going down quickly, then we're concerned. Then we're even more concerning. Okay, stage 3A, that's the moderate. That's anywhere from 45 to 59. Okay, that's when we start getting concerned, because around that time, that's when most people start becoming symptomatic. So we start getting a little more concerned. Again, looking at your blood work, looking at the medications you're taking, looking at the doctor you're seeing, were you in the hospital recently or no. If you go to the hospital for any other reasons, most of those numbers, when they do the blood work right away, they'll find out right away. And they can look at everything mainly right away, because you're there for other reasons, or you start having like your dizziness and all, and they can look at all of that. Because if you went there for dizziness or chest pain, all they do your whole blood work and look at it right away. Okay, and if you came to the office and you were having issues like that, we're sending you right away to the emergency room. Not even doing it. We'll do what we have to do and send you right away. Stage B, moderate. Also, some places don't count it 3A and 3B. They just go 3. Okay, when you start hitting stage 4, that's when we're like, okay, things are getting real now. By this time, you're symptomatic. When you're like stage 3 and you also have other diseases, like I said, your chronic kidney, your diabetes, blood pressure, you having other issues with your liver, you having other issues that are not well managed, by then we've already sent you to nephrologists. Nephrologists is the kidney doctors. Okay, they look at things a little bit more in detail, at depth, than we do in the primary care settings, and we kind of work together, because I'll say, I'm sending you this patient who has this, and 15 35-year-old patient, history of this, and the last set of blood work I did is a patient symptomatic. Can you please see this patient? Hopefully, sometimes this week. And not, can say sometime this week. If it's not bad, if it's bad, we'll send you to the emergency room. But can you please see this patient for me and follow up with that? And the patient goes there, and we'll do that. If you're diabetic, you're gonna be seeing, when you get to like stage 2 or 3. Stage 2, usually we already sent you to see the nephrologist anyways, because you have to have routine diabetic care with a nephrologist. You have to look at your medications and make sure everything is right. And then they will tell you follow up every 6 months or every year, depending on where you are. Okay. Stage 4 is 15 to 29. When you get to stage 4, like I said, at that point, that's when we're talking to nephrologists, we're talking to the surgeons and all that too, because then we're headed towards dialysis. All right. And then stage 4, that's end stage. That's when dialysis, period. End of story, dialysis. Now, you can also, somebody might say, is this reversible? It can be reversible, because like I said, if you have other issues that are causing a kidney disease, once you remove the offending agent, then you get like a couple of days of treatments of dialysis. Then you may not need to have it anymore, because let's say if something was going on with your liver and we fix your liver, or something was going on with your heart and we get the heart everything together, then we don't have to you don't have to have dialysis anymore. But usually they will keep the device in until they find out that you may not need it at all, and then take it off. But once you get to that point, you want to make sure now that you stay healthy, because we'll continue monitoring you just to make sure you're in the right place. Okay, like I said, stage 5, less than 15. That's what you call end stage renal disease, and that's when you need dialysis. So the signs and symptoms, I again reduce the amount of urine. Let me take a little break. Reduce amount of urine, swelling of your legs, ankles, and feet, because your body is retaining the fluid. That could also be a sign of CHF2, congestive heart failure, like we talked about 2 videos ago. Go back and read that, because your heart cannot function properly, and then also your kidney is not taking the fluid out. Okay, so you start looking at your body cannot eliminate the water, so you may need some medication, and then over time you may need dialysis. Unexplained shortness of breath, like you just become more short of breath, like if we ruled everything out, it's not COVID, it's not any kind of asthma, you don't have chronic obstructive pulmonary disease like COPD, you don't have anything else like maybe obesity or something else, anything else that's going on that may cause that. After we rule everything out, meaning we look at everything and that's not it, then we say, okay, let's start looking at the kidneys. Of course, we're going to be doing blood work too. Excessive amount of drowsiness and fatigue, because if your body is not the kidneys is one of the things that also produces and maintain the production of red blood cells. You need a red blood cells so you don't become anemic. So if you're tired and you're drowsy and you don't have all that, you don't have enough oxygen and the blood cells, not your blood count is low, of course your body's going to be like, because you need a blood going, you need, like, let's say you're sitting here and you're responsible for putting stuff to go through to get the body like a balloon. And if there's less of that, the balloon starts going closer, slower until it kind of collapse, because you need that for the body to move and function properly. Okay, persistent nausea. And like I told you guys, there are some diseases, there are symptoms that mimic different kind of diseases. So when you go to the hospital or you go to your doctor's office and your doctor say, oh, it could be this, and this, and you'd be like, I don't know what he's talking about, because I mean, how can you tell me I have this disease, or this disease? Why don't you just tell me what it is? No, because like I said, most important thing, we want to rule out the most serious one. You're not having a heart attack, you're not having a stroke, you're not having immediate anything with your liver or your appendix that's going to cause any immediate problem. Once we get that out of the way, we can say this is what we're looking for. So we may send you to three different specialists, all right, or three different things, and then we come down to what it is that's bothering you. But once we do the blood work, we can look at your kidney function. Confusion, because when you don't have the blood going through your head and oxygen, yes, you become no you'll be confused, because you need that. The body is so amazing that any little thing can cause it to start functioning and improperly. But once you get everything together, it works. And it sometimes compensates too, because over time the body's like, the head will say there's something going on with liver, you need to get more blood over there, you need to do this, you need to do that, you need to do that. So it kind of function compensates for other things that's going wrong. But then after a while, it's like, we need help, get help. Okay, so that's why it's important to make sure that you always follow up with your doctor's instructions. You go to your doctors and provider. I do stop saying just doctors, providers. Okay. Seizures, because once again, if your brain's not functioning properly, the brain's like, the chemicals going from the heart to the brain and all that, it just gets haywire because nothing's working properly. Coma. Once you get to that point, then you just, next step will be death. So it's very important. It's very important that you go. Anemia, I already told you that the erythropoietin is what the kidneys, that the hormone that produces the red blood cells and all that. So if it's not there, that's why most people who have kidney disease, and once they end up with dialysis and all that, even prior to that, they need blood transfusion very frequently. Not everybody, but some people do, especially considering if you have other pre-existing conditions too. So you may need blood transfusion. Most of the time when I was in the hospital, we had patients that needed blood transfusion when they were in dialysis. So that's important that you have a good blood bank where you are. Okay. The diagnostic testing, like I said, well, first thing when we do your urine, your basic testing, we do your urinalysis. That's when we send you to the lab, or would take the urine right in the office. Excuse me. We'll be checking there, looking at the color. When we get the reading back, get the results back. I'm looking at the color. I'm looking at the specific. I'm not going to get too technical. I look at all that, making sure it doesn't say occult blood, making sure it doesn't say hematuria, the ketones, and anything that doesn't need to be in your urine. Anything that's not there, that's going to say, okay, to keep an eye on this. And if there's bacteria and other stuff, then it's going to tell me, okay, it's going to go to urine culture. And that's when they look at it deeper and they tell you where there's any kind of bacteria. But at the same time, if there's like the crystals there, anything that be causing any kind of kidney stones or all of that, any kind of obstructions can also lead to like temporary kidney failure. So again, like I said, once you remove the offending agent, that can happen. But if you're talking about chronic kidney disease, then you want to make sure you keep an eye on that. We check in to see how much urine you're putting out. Sometimes some nephrologists will say, especially when you're in a hospital too, we give you a gallon and tell you whenever you pee, you urinate, keep it at all times, and we look at the volume over a 24-hour period and see what's going on. And if there's anything concerning, by then we'll be working with nephrology. Blood samples were checked there, looking again at your blood urine, nitrogen, sorry, creatinine. If we have to do like an ultrasound to look at your kidneys, because usually if you have blood in your urine, and we repeat it over time, especially with women, if I get your urine sample and I see if there's blood in there, I'm going to ask you, did you have this done when you were close to your period, right after your period? If you're a woman who no longer sees a period, or you're on some kind of oral contraception that stops you from seeing your period, all of that we ask that first before we send you to like any more testing. That's going to be a little bit more expensive, and sometimes the insurance company might say, did you do this and this before you do that? CAT scan, so make sure you have all those things where you are. And sometimes they might do a tissue sample. They might take it and do like a biopsy to make sure nothing else is going on there, like kidney cancer. So, and hopefully that won't be the case. All right. And so when we have all that, and like I said, you get down to the stages, and we at that point, then you have to make sure that, by then we have all that. So what other treatments go along? What other, like, this is where it comes with a multidisciplinary team. Okay. When I talk about these things, and I talk about it as an expert in my field, I'm not a nephrologist, but also I've also worked in a hospital for so many years, and then also now I'm a provider, so I have to know these things, because when I send these cells, I have when I'm collaborating with another doctor, another specialist, all of this, when they send the results to me, they send the consultation notes, I have to read it and move on from there. So, and I said a multidisciplinary team. You cannot have a dialysis center, you cannot have dialysis treatment if you don't have these things. Okay, you can build it, of course you can, it's nothing wrong with that. But in order to be able to function and to have properly function, and to run in case of complications, you have to have all these people, starting off with your PCP, your primary care provider. Okay, this is where we come in, and we're looking at everything, looking at your blood work prior to all of that, and making sure everything is okay before we start looking at everything I just explained to you, before we send you to those other doctors or do more testing. Okay, if you're in the hospital, everything will be done right away in the emergency room. And then also the doctor in the hospital will consult the nephrologist and the cardiologist. The cardiologist, because chances are more than likely you probably have high blood pressure, and the kidneys, they may have to address your cardiac meds. Maybe that's what's causing the blood pressure. Maybe that's what's causing the kidney disease. So they have to work with the nephrologist. By the way, nephrologists and cardiologists, they fight all the time, because it's always like, okay, this, and this. And we were like that in the hospital. All righty, it's so fluid. Take the fluid out. Don't take that many fluid. Don't take that much. So it's like back and forth. Anybody who knows about medicine, cardiologists and nephrologists, they go back and forth with each other. The nephrologist, of course, the kidney doctor, endocrinologist, because if they have diabetes and they have other issues, thyroid diseases too, that can also affect the kidneys. Rheumatologist, in case if they have like an autoimmune disease like lupus, like I said, that can also affect the kidneys. Endocrinologist for diabetes. Surgery, if you need dialysis access. Some people get the graft, they get the graft is in the arm that's surgically implanted with the surgeon. They do that in the operating room, or interventional radiologist, and that stays in there, and that has to be maintained, because every time, sometimes it gets blocked, and you have to have the surgeon on call to make sure they send the patient down, or to interventional radiology department to make sure that's opened up. And that's when they put a temporary cath, the permanent cath, that can go right here over the chest area, and have the different openings there, and they can do that until that is mature. Because even if they put the graft in here, that has to mature, meaning it has to get to the point where this is safe to use, and they use the permacath until then. All that, you have to have your radiologist, you have to have all those people involved in there. You have to make sure you have a good lab, because blood work needs to be done right away, and if the patient needs blood, they have a blood bank. All of that have to be in place when you're doing things like that. Social workers, because when you start doing that, you have to go to dialysis 3 times a week. Okay, if when it first starts in the hospital, because they have inpatient dialysis where you're there as a patient, and then when you're discharged, you have the dialysis center different places around in the country. Okay, so you have to have 3 straight days of dialysis treatment, which is 3 to 4 hours each time. When you come from there, you're so exhausted. So that can also affect the family too. So that can also affect your livelihood, meaning how much money you're making before that you can do your regular job. You may have to change your shift. If you have small children, that can affect, whether to go to school, where to go to school, how far, and all of that can come into play. So don't think It's not something where you can just say, oh yeah, I'll just do it and poop and get out. No, it encompasses your entire life and encompasses the lives of everybody that live in the household and people who depend on you. There's some people who, let's say you were in your 30s, 40s, you have young children and you also have elderly parents or elderly people you're watching. What if you were the person who were to go in between, taking mom to her appointment, taking Bobby to his football game, taking, Ellie to her ballerina and stuff, all of that. When once you start dealing with chronic kidney disease, all of that is affected. So if you have to go away for vacation, you can't go too far because also if you're going far, you have to make sure that you have a dialysis center over there, and all your doctors have to send everything, your prescription and everything directly to them. So when you're there, you can go for your treatment, because you miss one day, you're very short of breath. You are very, very short of breath, and you start becoming symptomatic right away. Two times, by the time the third time, it may be too late by the time you get into the hospital. So it's important. You see why I say it affects your whole life. And what if you were living somewhere that didn't have all of that? Okay. Um, Lab, like I said, you're going to make sure emergency response system. You have to call 911. What if something happens? You want when in let's say you have a home nurse, and we'll also teach you to listen, to feel that when you have your graph, to make sure you feel, because you're supposed to hear that shh. When we listen to a stethoscope, we have to listen for the thrill, and feel the thrill, and listen for the brew. So that has to be there. When you don't feel that, you be like, wait a second, I don't feel that moving. I don't hear any sound. You have to get to the hospital as soon as possible, because they have to make sure to open that up, because if you're due for dialysis the next day, you want to make sure that's open up. What if that comes ripped open? What if your permit cap, it doesn't fall off? Or what if something happens? You're in something traumatic and something happens. You have to be able to get to the hospital right away, and you need 911, because if you're really short of breath, you're not getting into the car, and God forbid you run into traffic, or you have to wait at the light and all of that. So you want to make sure that all of that is in place already. Blood bank. Again, like I said, the kidneys is responsible for making and maintaining your red blood count. So you want to make sure that there's a blood bank available where you are. So if you need blood, it's there. And especially now where we have like so many other, the pandemic going on and everything else, the rare cause, it's like really they have to ration out how much, who needs the blood and who's going to get it and who needs it. But if you need it right away, chances are more than likely you're going to get it. All right. And the pulmonary doctor, if you're having any asthma or anything else, they may come into play. The dietitian, because they have to make sure they tell you what kind of food you can eat, what kind of food to avoid, and all that when you're on dialysis or you have chronic kidney failure. That's going to cause that, again, maybe nephrotoxic, meaning is harmful to the kidneys, and you've already in that position where you can't afford to not to do any more damage to your kidneys. And infectious disease, because if you get sick and you have kidney disease, there are limited amount of antibiotics that you can be given that may not be caustic to the kidney. So infectious disease, all of them play a part. Again, this is not a comprehensive list, so I'm just going to go in. I really didn't want to talk for more than 30 minutes, so let me just open up my screen and see my comments first. I feel like I've been talking forever. Excuse me. Okay, so Jackie said, you can only sing for the month of February, people. Sorry, no, I was told I had to sing for March, people. Okay, let me see where Dennis says, I have to wait until September before my birthday song. I guess so. But I said happy birthday to the first lady. So, her birthday scene. Was it March? Oh, I probably got that wrong. Yesterday? No, it's February. Okay. Um, and Jackie says again, great topic. Thank you again, Jackie Jackson. And Jackie said, can you kindly break it down, please? Because you have some people watching and don't understand the medical terms. Also, different cultures are watching. Will you be watching later and need to fully understand prior to go into the medical appointments? Okay. If anything else, if they have any other questions, they can always just add it there and I can respond to it. But like I said, the most important thing is going to your doctors, repeatedly, making sure, not repeatedly, but routinely. You don't want to miss your appointment because it's, first couple of stages, there is symptomatic, and if you're taking medication, diabetic drugs, antihypertensive drug, meaning high blood pressure medications, if it's untreated diabetes, untreated high blood pressure, if you have heart disease, or if you have um, um, if you had sometimes if you also have had a heart attack before a stroke, that can also affect that. If you take things like NSAIDs, meaning your naproxen, your Aleve, your ibuprofen, all those things. So all those medications can be harmful to the kidneys. Severe dehydration. I'm just trying to do a quick conclusion here. But most important thing, you want to make sure you go to your doctors and make sure you go there and say, can you please explain my lab work to you? Most doctors will explain your results to you, and just say, I was listening last night. It said something about chronic kidney disease. Could you please just tell me if I do have it, or what medication should I look out for? What antibiotics is this gonna how is this gonna affect my kidneys? Now remember that we do give you medication. Sometimes there's no other choice that you have to get that medication, and it may affect if in the short run. So we have to keep an eye on the fact that okay, you may become dehydrated, which may cause temporary kidney and failure, and we can always replace that with some IV fluids because you absolutely need this antibiotic. You absolutely need this medication that we're doing or this procedure. So like some certain like CAT scan and things like that, we usually will tell you don't take the diabetic medication. Certain diabetic medications don't take it 40 hours after because the contrast can also. And we tell you you come back. We'll tell you to make sure you drink a lot of fluid, so you just watch all that die out of your system. All right, let me see where did Musu say. Musu said, can someone have mild kidney infection and before the cure? Yeah, yeah. Like I said, it's reversible if you take away the offending agent. Meaning, let's say if you were taking a medication that was causing it, yes, you can do it. And also for a urinary tract infection too, once you treat it, some doctors will repeat the urine test again after you've had it, the medication. We'll repeat it to see where you are, and also we can repeat it in 1 month, or we can repeat it in 6 months to see where you are. So you want to make sure that yes, that can be it can be. I'll say reverse. I don't want to say fully cured. I'll say reverse and then become stable again because they still have to monitor you just in case that whatever it wasn't like something that was just episodic, meaning it was just a one-time thing, and you could come back to being okay, or it was something that we'd have to keep an eye on for later on because we'll go back and read our notes and say, wait a second, you had issues like this before, so let's just make sure that it's not something that's chronic, and we can go back and address it. Okay, and what did Jackie say? What are some of the good ways to encourage individuals to seek proper care with such important topics? These people are in some serious denial regarding health issues. Oh, I am. Ooh, that was a loaded question. Just tell them, just say, you know what, like I always tell people, and I said when I discuss colon cancer, and it'd be like, I say you have to get your stool sample, and they're like, oh my God, I don't want to do that. I want to do that. That's so disgusting. I don't want to do that. And I say, that's something that's going to take 5 minutes out of your time that will prevent you from, may prevent you, I can say completely, or may prevent you from having something devastating later on. Go to the doctor. I know you're scared. Trust me, we health professionals, we're just as scared. Trust me. It's like, and it's well, we know so many things. So it's like when somebody says stuff, we're like, oh, my head's hurting. Oh my God, I'm sure I got something really bad. Oh, we don't look at like the middle part. It'll be like maybe you just have a headache. You think maybe you just have a headache? Oh no, we can go down all the diagnosis and all. So we worry about it too. But I always tell people it's best to find out because there's certain things where, if you don't, you may not want to find out. You say, oh, I just pray to God and everything went away, or it may go away. Again, like I said, it may be something just like episodic, but it may not. Do you want to take that chance? And you can always go for a second opinion. You can always go for a second opinion somewhere else, depending on your insurance and all that, especially when after, and some people are still in denial, even if we take the paper and say, look at this is what we're looking at. And some people are still in denial. And we just have to say, this is what we're dealing with. And if you want to come back, think about it, talk to somebody else, and then come back. And a lot of people out there, you sit there, but like, oh no, Google said this and Google said that. I keep telling people when you're on Google and you're looking at everything, it's like they tell you there's a disclaimer and always on their story. And if a story doesn't say, or an article doesn't say a disclaimer or tell you how to follow up, you don't need to be reading that article. Okay. We don't want you to come in and say, oh my God, doctor, tell me everything you know because I'm so ignorant and you're the doctor. No, we want you to come in informed. We want you to come in informed. We'd like an educated, informed patient, but also come with the understanding that when we're looking, or you're looking at that article, we're looking at much more than what's there. We're coming with the training that we went through, okay, the clinical hours and all that, all the specialists, all the many articles, peer review articles that we have to read. We don't read the Google articles, peer review articles that we have to look at everything. It's like somebody coming and say, doc, why, they told me the first medication I'm supposed to get is and metformin for my diabetes. Why aren't you giving me that? But look at your GFR. At a certain time, we can't start you with that medication. We have to start you with something else. So what you read in Google may tell you that, but it's something totally different when I'm looking at the bigger picture of what it is that I'm dealing with. And I, as a clinician, I'm responsible for looking at everything and everything else that you're not looking at. You see where how somebody goes into emergency room or a doctor's office and you say, why did that person take so long? Or why did you take that person in before me? Well, most places have a sign that you're not going to be seeing the doctor or the healthcare provider in the order that you came in, because maybe something else that I need to take care of this person right away that may run over into your time too. So we do try to apologize and be as sensitive as much as possible, because of course you took time off to come to the doctor's office, not to sit there and wait or be taken back, but also understand that sometimes you may have to wait a little bit longer. Okay. And let me see what else she says here. Especially these old, Jackie Jackson said, especially these old, Jackie Jackson ASCII. Okay, let me especially these old people and the children who don't like to listen to medical providers. Especially if you're older. I'm telling you, I tell people, I say, when I get like 95 years old, I don't care how many medications I'm scheduled to take, I'm taking one. I'd be like, I made it to 95. I don't think I have to take 10 medications. So it's, when you're old, you're set in your ways. And you're always saying, well, I made it this far. And when nobody and all the things you told me, and I didn't do it, and I made it. So why should I keep doing that? I don't, this doctor doesn't know my body. And we always tell you, you know your body. You know when something's wrong. But at the same time, you're not going to know exactly what it is if you're not getting tested, diagnostic testing and blood work and all that. So we're taking your symptoms. I did a show on HPI, meaning your history of present illness. When you come to us, we listen to you. We listen to what you're telling us, and everything we tell you. When did it start? How often does it happen, and all of that? We take that as a subjective part of the note. So we're taking everything you're telling us into account. We're not just ignoring you. Then we do your physical examination. Then we put your possible diagnosis down, and then we send you for all these other testing. We may give you some medication there if it's warranted at the time, and we send you for diagnostic testing. And when we do that, when we call you back in and explain this is what's going on, this may be the reason why this is going on. And all we can do is try to encourage you to, like, please, do the best you can to take care of yourself. This is what we're looking at. And if you choose to say, no, I don't feel like doing that, then there's not much more we can do. But of course, usually it's like, it's like when somebody the change in life and all that. So you just gonna be like, this is what we're looking at, sir. All right. So I would really appreciate, think about it. Go home and think about it. I know it's a lot to think about. That's why I didn't say psych. You also need psych when it comes to chronic kidney disease too, because it's a whole lifestyle change, and they can bring on anxiety. It can bring on depression, because if you're the breadwinner, you're the major breadwinner in your family, or even if you're home wife or home dad, that's still a change in life and all that. So it's also important that if you get to the point where you're so depressed and everything, and we may ask you, do you want to speak to somebody in mental health? Doesn't mean you're crazy, because people just, so it doesn't mean that. Okay. And all of those people, the multidisciplinary team, it's not just one person doing it. So I don't see any other questions. I'm just going to conclude. I had like really thought of doing this like, 15 minutes. But anyway, so in conclusion, and the reason why I say this when I'll start with this and try to be as sensitive as possible. I remember when I worked in a hospital, okay, and we had a prisoner. We have prisoner patients and all, and they have to be handcuffed to the bed. Let me see that. But summertime, okay. So the prisoner, and we were going in, so as nurses and other healthcare providers, we're just walking right in. Yeah, I used to go into the patient's room, especially if you look at I worked on the heart floor where we're looking at a heart monitor, and you have to run in the room when when the numbers look like the person's having like severe arrhythmia, meaning there's something going on that you need to be in the room right away to make sure the patient is okay. And so we'll go in the room and run in the room, and the guards, like we usually have two guards, and they were like standing there moving, and he's like, "Whoa, whoa, whoa, whoa!" And it's like, "What? I gotta see my patient. I gotta see my patient." They're like, you cannot go in when we're changing shifts, because that's when they're changing the guns or whatever they do, or their garment. I'm sure it's called something different than garment. Anyway, so they say you can't do that. So I'm just saying, the reason why I say that story is like, because when you're in a different expertise, okay, yes, we're supposed to look at that our safety. We do that every time. But somebody else who was looking at it from a different point of view, looking at and like come okay, law enforcement point of view, they're thinking, okay, we have to make sure we protect that patient. You protect the first important thing, you have to protect the staff, then you have to protect the patient. You have the patient is just as important too, but you have to make sure, because of that person who's a criminal, or person who's going to trial, whatever it is, if they become loose, chances are more than likely they're going to grab the gun. They're going to grab something from the tray that may cause harm to the staff, and then also harm to the guards, and then cause more harm. So they're looking at it. So when I see people making comments, and for those of you who are my American audience, I'm a Liberian by birth. When I see things, everybody's like, oh, they're doing the dialysis center and this and that. I'm happy. I'm happy that's going on. But if I come in my expert opinion, and other people who are also health providers too, and they know this, okay, they know that. And so if I'm saying you're supposed to think about all those different multidisciplinary people that I just listed, and also the EMS system and everything else that you need blood bank and all that. Those things are necessary, not optional. They're necessary if you're going to go into any kind of specialty care, any kind of thing, specialized treatment, anything like that, anything modern. You need those things in place. Concurrent development. That's one thing I notice people don't do. Like they will do this and it's okay, eventually the other one will come. So when somebody coming to that, it seems we had somebody who's like, an engineer may come across something and say, this is a little different. Let's do this with all these people come to the table, and for you make those development and all that. So when we come with that, and we're not coming to say, oh yeah, we're trying to bash this country, or we're trying to do this, or we're trying to do that. It's just that when you come into the developed world, that's the reason why you come to the developed world, more developed world, and you learn things the proper way, and you're exposed to things the proper way. If you then not take that back, or not say, maybe why don't you do it this way a little bit and add that part to it. No, everything can be done at one time, and we understand the funding and all of that, but let's keep doing that. Let's make sure, how soon can you get this done, how soon can you get it. It's not, that's what it's called. Constructive criticism is lending an expertise voice, because what we're saying for free, you'll be paying for that. If you were bringing a nephrologist to that place, if you're bringing the social workers, if you're bringing that, all those people will have to get paid. So when we come across and say that, it's like you're not talking bad about anybody. People need to get out of that mindset that, oh my God, the minute somebody says something, that means they're saying something bad about this. Oh, you don't like this, or you think you're this and you think you're that. Let's get past that, people. Let's get past that. Okay, we have so many illnesses out there, so many major diseases out there, so many things that we have to work and conquer and manage and all that. We can all lend our hand and our expertise differently, and don't say things like that. Not say don't say things like that, but have an open mind when people bring their expertise, and it may look like criticism, but it's constructive. Okay, so bottom line, see your PCP yearly or as often as you're supposed to. Follow up with a specialist. If you start having the symptoms that I talked about, bring it to their attention, and they're going from there. Okay. I hope what I said today has helped somebody or will help people. For those of you who are watching now, I say thank you so much. Thank you always for your support. For those of you who will be watching later, I say thank you as well. For my friends on YouTube, I say thank you as well. What is, I think I know. Dennis just said, who is a nephrologist? A kidney doctor, somebody who studies kidneys and work. There will be the main person coordinating your dialysis treatment. So they write all the prescription and everything, and then they send it down to the dialysis center, and the dialysis nurses and other people who work there, they follow that and do all the concoction and all. So that's what a nephrologist is. Okay. And Sue said, "Thank you for educating. Thank you so much for your support, and I love watching your channel too as well, Sue. So we're all in this. We're all, we're all part big little pieces of a big puzzle. Okay, so we all have to be there for each other and support each other. So thank you all. I've talked now for, oh my God, almost 1 hour. Jeez. And I just put all this together in the past hour. So, but anyways, I love talking about healthcare. That's my cup of tea. I love teaching because that's what I did, a lot of precepting and all that. And if you have any questions or comments, you can always put it there and I'll respond to it later. Thank you again. It's Tuesday, it's March, it's almost springtime. We finally get to get out of this cold, but March can be a little iffy. So I'm not going to be jumping up and putting my, maybe like late April or so. But you guys stay safe out there. Okay. I love you all. Thanks for watching. Thanks for your continued support. Good night. God bless. Namaste.